Welcome to the PIC Family Voices podcast, a space for families of children and youth with disabilities and special healthcare needs and the dedicated professionals who support them. Join us as we dive into topics from early childhood and healthcare to education, behavioral health, and life after high school, everything that shapes our shared experience. Our mission is to equip you with the insights, resources, and a supportive community to help you navigate this journey in ways that work for you, your family, and the people you care about.
Today, we'll be discussing the transition from pediatric to adult healthcare through the lived experience of young adults navigating complex systems of care. The transition to adult healthcare brings significant emotional and structural challenges, including difficulty finding appropriate specialists, navigating complex insurance systems, and the transfer of health management from caregiver to youth. Support from trusted providers, family, and community services plays a critical role in building confidence and helping young adults manage these barriers. Overall, the healthcare transition is an ongoing process shaped by gaps in coordination, highlighting the need for more integrated and patient-centered care that prioritizes youth and young adult voices. Today, we'll be talking to two young adults, Keagan Watson and Justin Bonny, who will share their experiences that reveal both the challenges and the personal growth that come with navigating complex systems of care. Today, we're going to begin with Keagan Watson. Keagan, welcome.
Thank you for having me, Emily.
Thank you so much for being here. Can you describe what it was like for you to transition from the pediatric healthcare model to adult healthcare?
Sure, it was a little bit chaotic. So at about 19, things just started falling apart. I don't know if that was a funding issue or whatnot, but the first thing to go was the orthopedic, and then because of a few of his choice words, it really kind of made me feel nervous to seek out specialists in my adult healthcare. And then I kept on with two of the pediatric specialists till I was 21, and then the physiatrist that was on staff at the same appointment as the orthopedic, who had a few choice words for me, he said I would take you on as an adult because I work with all ages, because that's how I supplement my income. And but he said that I would recommend physical therapy for you, and so there really was no need unless I could find physical therapy to help. And so with that attitude in mind, I now currently don't have very few specialists, and I find that the system seems to be a little bit more fragmented. I don't know if that's the same across the board, but it's like you have a GI specialist who only knows about GI stuff, but she seems not to know about how the GI affects the entire body. And it's trying to get care for my condition. I have cerebral palsy is quite the challenge, because you don't know who to go to or what's appropriate, and you, at least in my case, I don't want to feel like I'm wasting somebody's time, because there are other patients who require care who I don't want to stand in their way if I'm not worthy of care. So
Thank you for mentioning the fragmentation aspect. How would you compare your experience with specialists in pediatric care compared to the adult care?
While those appointments every 6 months were very, very long, It was nice to, instead of going to specialist after specialist, to have them all meet there. It also, they were kind of talking at a higher level, most of them, than I could understand at the time. And so some of their observations didn't really make sense to me because I live my life and I see things on like a day-to-day. I'm sure I follow some sort of book pattern, but we don't live our lives in medical terms in a vacuum. So, at least as an adult now, you kind of understand it, but like I said, there's this fragmentation of care where it's like nobody communicates with everybody, and everybody is really intelligent but can't put it all together. And I think I have a good PCP now, but I've also had primary care providers who are responsible for kind of overseeing the whole thing. I have had some PCPs go tell me, why do I even have to see you, because you require specialist care. and the answer for those who are wondering is you need a PCP to oversee everything and fill out paperwork for you to access some of the specialized care.
Thank you. I know when you were planning for this episode, we talked a little bit with yourself and the person who was helping prepare the episode. You mentioned several people and organizations that were supporting you through this process. Who played the biggest role in helping you kind of navigate this transition?
Family, a little bit of like Waypoint and special medical services, which now doesn't exist. It's rolled into Waypoint, but and family and friends, and some of why I've sought out some of the specialists I have on my own is from hearing some experiences from those with similar conditions to how successful they've been.
How prepared did you feel when you had to transition over from pediatrics to adult healthcare?
I would probably give it a 5 out of 10, because I had a pathway I was told to follow, but with the issues I had, with the barriers and such, you really don't know how to put it together.
Right. And like you mentioned, the fragmentation of kind of going to one person for one certain issue, but how it's all related in your body, but for the specialists, they're only specialized in that specific area.
Yes.
So it can be a lot to adjust and transition over to. What do you wish someone had explained to you earlier about kind of the insurance or healthcare systems before you were transitioning over to adult?
So, I forgot to mention this. When I turned 18 and graduated high school, I ended up getting Medicare, and I wish somebody had explained to me better that became the primary insurer, because they play by different rules than like Medicaid. And when Medicaid becomes, maybe not necessarily different rules, but when they become primary insurer, it kind of messes things up. And I remember talking to my equipment provider, and it was a whole set of different paperwork that delayed me in getting one of my motorized chairs, because I thought I was still on New Hampshire Healthy Families as primary, but they became secondary, and Medicare became primary. I did get a letter, but it was more like the pink Cadillac letter, meaning, here's all the things we can do for you. It wasn't, they didn't specify specifically that we are the primary now, and that would have been a little more helpful to know, or at least how that affects me.
Do you have any other specific resources that were helpful for you that you think other youth members might benefit from having?
New Hampshire Family Voices, they were a very good resource. I have, you have community, and they have access to a wide range of resources that they can navigate you to, both on the website and from conversations you have with some of the staff there.
Is there any last things you would wanted to add about the transition over from pediatric to adult? Anything we can offer youth for support or things to be aware of?
I don't want to use the word scary because it's not. I wouldn't term it as scary. It's a lot, but you can do it. It's. I really want to end on a point of optimism, because you can do it. It's just might be a little rough, and try to ask questions sooner rather than later.
Thank you, Keagan, for sharing all this great information with us today. I appreciate having you on the podcast.
Thank you for your time.
Hi, Justin. Thanks for being here today.
Of course, thank you for having me.
Can you describe what it was like for you to transition from the pediatric healthcare model to the adult healthcare model?
Yeah, definitely. So it was quite a difference. I noticed when I first transitioned, my insurance provider had assigned a PCP to me, um, just by default, and we couldn't really get in touch with them, so we ended up trying to find a different PCP um, that was more, well suited to my needs as someone with a chronic condition. And we didn't find one, but it took quite a while to get an initial appointment with them. I think it was almost a year before I saw them in person for the first time. So in terms of finding a PCP, that was definitely a tough one. Um, it would have been nice to just be able to stay on with the same person because they know me for so long. Um, but yeah, so in that sense, it was a little bit difficult. And then I think for the most part, with specialists, that obviously stayed the same. Um, so that wasn't too bad. Um, it was definitely a bit getting used to with having to all of a sudden I'm the one that has to schedule my appointments and keep track of everything. So it was definitely a learning curve in that sense. But yes, that's sort of how the transition was for me at least. I know that at least with Mass General, I think you can stay on with your peds specialists as long as, they have a child, if there's a limit, but I know that for some of my friends who are very different providers, they have those cutoffs with those specialties, and you have to, at a certain age, you have to transition to an adult specialist. And yeah, that's not how the transition's been for me. And I feel like now I'm just finally starting to get the hang of it now. So yeah.
That's great. Are there any particular challenges that kind of stood out for you as you've been navigating this transition?
I think um, well, just said earlier, trying to find uh, PCB specialists in the first place was challenging. In my case, having a PCP that kind of was was used to dealing with people with chronic conditions. Uh, that was the big challenge for me. I think, like I said too, like having to suddenly handle all of my care and deal with insurance and all the stuff that comes with that. And, in addition to that, I have like a lot of people, like a lot of us, we all have, we all have jobs and other commitments that we have. We can't just devote all our time to having insurance and you know, handling all that. I'm lucky enough that I have a great case manager who is able to handle all of that for me now, but that wasn't the case in the beginning, certainly. Um, I was always the one. My parents were a big help too, but I was the one that had to, type insurance companies. I had to, you know, all the stuff that my parents used to do. I had to, start taking over and start doing, in addition to my other, regular responsibilities with my job and my, university and all that. So, yeah.
How prepared do you think you were for this transition to adult healthcare?
It was definitely challenging. Uh, even with all the help I had, now, transitioning to handling that stuff myself. Um, it was still definitely a challenge.
That's a really good point that you made, that you have work and different things, and it's a lot of different things that you have to navigate. And I think you mentioned too that it was a big transition for you from having the help from your parents and now doing these things, navigating the appointments on your own. Is there anything else you want the youth to know about navigating these changes from the pediatric to adult model of care?
Yeah, I would say that it may seem overwhelming at first, but I think the most important thing is to find a good case manager, uh, because they mine at least has been a great help to me, and is able to I can email them and say, hey, this is what's going on. I don't have time to deal with this. Can you talk to the you know proper people, the insurance companies, and mine's been great at sort of handling that stuff and helping me get the things that I need. So that's honestly the number one thing is find a good case manager. Um, they're definitely they're out there, definitely, and at least I would also say that have the choices for independence, waiting for the CFI waiver. Uh, that's been, I would say, for anyone that qualifies, uh, definitely get that, because that's it's a big help in addition to the services I already get through Medicaid. a great resource. I've learned a lot from my case managers over there over the years, and so. But yeah, I think the main thing is, like I said, it may seem overwhelming at first when you have to suddenly take all this on. But once you sort of, figure out, once you sort of figure out how to navigate the system, it's, you get used to it, it gets easier. Plus, like I said, my parents still help me, to this day with figuring all that stuff out in addition to my case manager. It's definitely manageable once you get the hang of it.
Thanks, Justin. Is there any final thoughts that you wanted to add? I know you covered a lot of things about the transition from pediatric to adult and all the different components kind of what youth need to know.
Yeah, I would just say the most important thing is really make sure you have some sort of support system. Because especially here in the United States, it can be a difficult thing to try to navigate this healthcare system of ours. And there's tons of things that I've never known about and not utilize my support system. Like, I would say, for instance, the MEAD, MEAD program, which is New Hampshire's Medicaid buy-in program. It's one thing I was worried about when I'm still in university now, but once I graduate, that was, well, what's going to happen when I start working more hours in a full-time job and I lose my benefits because I'm making too much. And so that was my number one concern. And because I know that, private health insurance doesn't typically cover PCA and private duty nursing. So it was a big relief to hear that there are things out there like the MEAD program. Every state has some sort of program you can buy into Medicaid as a premium, and so just things like that as an example. Just things like that. I've known, I've not had that solid support system. So that's like my number one piece of advice is if you don't already have that, find people, find people who know that stuff and who can help you navigate, because it's difficult to try and do it by yourself. So,
That's a really great point, to have some people to help take the load off of you a little bit.
Yeah.
We can also link some resources, Justin, if you want to include any resources. We can include them at the end of our episode as well. Some of the ones that you might have just mentioned.
Yeah, definitely. Yeah.
Thank you, Justin.
Of course. Thank you for having me.
Thanks for tuning in to the PIC Family Voices podcast. If you found this episode helpful, be sure to subscribe and leave us a 5-star review. It helps us keep bringing valuable resources and stories to families like yours. Until next time, take care.